an MIT-trained neurosurgeon recently quit his job, and he's making YouTube videos with his dog, Goobie, about hiking in nature and up in the mountains and meditation and just living a healthy life and good diet. His name's Dr. Gooby, and I think that video's had about 11 million views in just a few months, and there have been a number of healthcare providers and surgeons and others responding to his experience. I was intrigued by it, certainly, and impressed by his courage, and I resonated with some of it. I'm a physician, and I'm on my own journey to understand and transform, hopefully play a small role in transforming our health system. Dr. Gooby was disillusioned by the healthcare system and his experience with spine surgery. It affected him deeply, emotionally and mentally, and so he came to a point where he felt like he had to leave. I've had my own journey that I'd like to share. I think the authenticity of Dr. Gooby is inspiring, and I think it's helpful. I think it's helpful for just to show the humanity of healthcare and medicine. It's helpful for physicians and nurses and others in training, and hopefully helpful for society as well. So I was motivated to become a doctor, certainly because I wanted to help people. I also found science interesting, and I was interested in the idea of a stable job that could bring in a good income. I majored in philosophy, which allowed me to think about the big picture and to think about what's best or what's really good. Medical school is challenging. There was a lot of memorization, specifically about parts of the body and how the body functioned and what different medications could be used to treat different diseases. I was trained in emergency medicine. My program was 3 years long, and it was very rigorous and challenging and focused on one particular patient encounter at a specific point in time. It was also stressful and had an effect on me, my physical well-being and mental well-being, just because of the long hours and the stress that was involved. I became interested in global health, so I did some work in Mozambique and was deeply affected by, at that time, HIV/AIDS was causing a tremendous amount of suffering in Africa, in Mozambique. And over time, as I cared for people there and worked for an organization there, I came to realize that culture and social factors like poverty or discrimination or one's gender influences health more than what doctors and nurses and hospitals can offer. So I decided to get a master's in public health and got that from the Johns Hopkins School of Public Health. And during my studies, I kind of stumbled across a way of thinking about health and healthcare called systems thinking or complex systems. And the idea is to consider what we really want, in this case, health and well-being for all people at the lowest possible cost, and then design and iterate and improve and adapt the system over time to continuously hone in on that goal. And that was a really important turning point for me, because what I'd seen in the system through my training with emergency medicine and my education in medical school was that we were hyper-focused on one specific disease process or one particular patient encounter without adequate consideration of that patient's health and wellness over time and our entire society's health and wellness over time, and particularly how our organizations and culture and institutions contribute to that health. I taught at a university for a while those ideas of systems thinking, and at some point I came to a conclusion that a story had to be told because social change, it seems, happens when there are compelling stories that are told. So for the last 7 or 8 years, I've been researching medical history in the time of the 1890s, and that was an important period of time because that's when hospitals and surgery and nursing and public health, these were all novel ideas. And so it's a time when we could think and consider that things could have turned out differently. And there were health professionals at that time that developed approaches and philosophies and community-based interventions that could have turned out much differently than today. And I've given a TED talk about or TEDx talk about that very topic. A physician in the 1890s, a black physician named Lawson Scruggs, and his experience. So I still work in the emergency department full time, but I work at an emergency department that's less busy than I did for about 15 years. And that's to give me time to work on the book I'm writing, as well as other avenues like these videos to hopefully contribute to changing our health system. I'm in a bit of a slump right now. I have been for several weeks, in that I'm just having a hard time writing. So what I've done is I'm committing myself to creating one of these videos every day, and I'm going to post this publicly to hopefully put some pressure on myself to create these videos. So I'm going to answer a question every day. And so if you have any questions, please just write them in the comments. I'm committed to that and look forward to an ongoing conversation.